All right, Dan, thank you. And this afternoon, the CDC and FDA gave an update on the outbreak of cyclosporiasis happening in the U.S. The foodborne illness has made thousands of people sick, sending dozens around the states to a hospital. Joining us now in the studio is Dr. John Selleck. He's the hospital epidemiologist at Kaleida Health. Dr. Selleck, thank you so much for joining us today on the 4:30.
Thank you for having me.
So we have a lot to go over, but people at home have a lot of questions and possibly concerns about this parasite. So let's just start with the basics. What is cyclosporiasis?
This is a single-celled parasitic organism. Humans, this particular species that's causing this outbreak, is only carried. It's specific to humans. The transmission is a little bit complex, but it involves excretion of the progeny of the organism into the environment. Then it takes a week or two for it to mature. And then if you happen to ingest it at that time, contaminated water, contaminated food, then there's a good chance you're going to get it.
And our Kelly Dudzik told us last half hour, the CDC just giving an update saying that it has still not found the source of this outbreak. But we do know, well, now we're looking into how did it become an outbreak to begin with.
Right. Yeah, the problem with doing these investigations is very difficult because when you have this organism maturing for a couple weeks and then it takes maybe another week after it gets into you. So I defy most people to tell me what you ate 3 weeks ago for dinner. So it becomes very difficult to track it down. And the organism has traditionally been associated, as you're seeing on the screen, usually with vegetables, especially those that grow close to the ground. When they get irrigated with water that is contaminated, then the organism goes with those vegetables and fruits.
So one of the main questions, what can we all do to protect ourselves?
You know, the easiest thing is don't eat fruits and vegetables, which I'm not going to advise because that's not really very smart. But certainly things like tree fruit should be safe. Many health departments are now recommending that if you eat lettuce, that rather than buying a bag of lettuce, that you get a head of lettuce, discard 2 or 3 layers of lettuce, and then wash it. Washing helps a little, but it doesn't fix things completely. The other ground vegetables, you know, carrots, raspberries, which are not actually a ground fruit, but they've traditionally been associated with this as well. So there are some things that you could do that you could avoid it a bit.
Some good advice there. I have about 15 seconds left. Anything else, doctor, that you think I missed that you think the viewer should know right now?
No, it's very, you know, it's watching this happen. Much of North America, especially Mexico and then Central America, have had very wet years this year. Cyclospora likes hot and wet, and that's where a lot of our fruit and vegetables come from. So this is not totally unexpected, and unfortunately, much of the CDC epidemiology division that's responsible for tracking this was removed the middle of 2025, so we're actually dealing with this with a less than usual response.
Dr. Selleck, thank you so much for joining us today and for all your insight. We appreciate it.